Bustos.
Thank you, Madam Chair. Good morning to all of our doctors here today. Appreciate you being here. Thanks for your service. I'm going to address my first question to you, Dr. Tabak. And I want to thank you for your work on biomedical workforce, and so appreciate what you're doing there. I want to start by looking at the administration's work to address inequities. So the NIH plays a leading role in advancing biomedical research, developing diagnostics, improving cures, treatments, ailments, diseases. And really the impact that NIH makes is tremendous. And, if I want to, all the stats, but I drill down to the state of Illinois where I'm from. You've got 732 awards that were given totaling $311 million, and these are in these competitive grants. So we're very pleased with that. This opportunity to use the funding to advance biomedical research is tremendous, but it also plays a meaningful role in addressing health disparities. So that's what I'd like to ask you about. I know that the NIH budget requests $350 million in increase to support research on health disparities. Can you talk, Dr. Tabak, about what broader impact that the President's budget request would have on addressing inequities that lead to disparities in access to care and patient outcomes?
It will do so in several ways. Our work in health disparities increasingly is being done at the community level. We have learned that you can't just parachute into a community, study it, and then disappear. And you have to establish meaningful trust. That takes time, but it's obviously quite worth it. And indeed, Dr. Gibbons has set up the so-called SEAL program. If I may, like him to comment on that aspect.
Please.
Sure. Thank you for that question. This is critically important. Addressing health inequities often involves what we call the social determinants of health. The fact that the context matters, the place matters. And so often, because these are such vexing problems, you need a multi-pronged, multi-level strategy that, as Dr. Tabak indicated, often begins in the community, that indeed knows its assets, knows its challenges, and even can co-develop with us strategies to address them. Certainly, we at the NHLBI have a program related to cardiovascular health, which is clearly problematic in certain communities, low income, rural, communities of color, in which community-engaged research strategies are being shown to be effective in, for example, maintaining blood pressure control, preventing strokes. Indeed, you mentioned Illinois. We have teams in South Side of Chicago literally working on this, involving members of the community actually who have mental health issues that are intersecting with their challenges in terms of their cardiovascular risk, that holistic approach that we can take in this context. This has been borne out to be very successful in addressing the pandemic, and indeed has a broad array of capabilities for a variety of those conditions, whether it's cardiovascular disease, HIV research, maternal morbidity, mortality. These strategies we're finding to be particularly effective.
And can we drill down a little bit more too? And can you talk about the President and whoever is best to address this, the President's budget request for NIH supporting the recently announced Equity Action Plan? Would that be best for you to address, Dr. Gibbons or Dr. Tabak?
I can start. Actually, any one of my colleagues can speak to this because each institute and center is developing such a plan for their own individual organization, understanding that there is some variation among the groups. And in it, they will point out what gaps exist within their own organization, both in terms of what they do externally, but also internally. And these plans are going to be shared among all the institute and center directors so we can learn best practices. And this will be an annual event. And so they will be updated going forward.
Great. And just to play off of Dr. Gibbons a little bit about what you said, Chairwoman DeLauro and Ranking Member Cole have been great on this issue, but we actually have a Social Determinants of Health caucus. I'm the co-chair of that. And then we have a bill called the Social Determinants Accelerator Act, where we had initially asked for $25 million that would, to your point, Dr. Gibbons, that would start at the local level to come up with plans. And then we would have this interagency council that would then help decide where these grants go. And so we got 3 million last fiscal year, 8 million this fiscal year. The president put in his budget $153 million for it. So we want, that number needs to grow. Obviously, that's the job of the appropriators and to be able to get that through. But something that I think is really the answer to having these, looking at this at a very local level, the social determinants, and helping really get healthcare in a better place for so many people who need us to pay attention to this. So thank you very much again to all of you. Thank you for your service to America and for trying to make people healthier. With that, Madam Chair, I yield back.